So here we are in Digital Leaders Week with Stephen Pink, the CEO of SELDOC and Verve Healthcare, with the title of Losing Sleep in an SME, how to use data and insight to proactively improve the well-being of your SME staff and leadership. Stephen, you yourself are a leader of an SME, so you've got two hats on, or three if you count the two companies that you're CEO of and the fact that you're an SME as well. Tell us a little bit about yourself.
Well, I suppose I started life in large organisations and I've ended up running two smaller ones. And that comes with challenges. I think sometimes people think running a smaller or a large company is easier than the other, but it's both a tough ask for whoever does it. And I think in a small company, one of the things that really hit me was just how vulnerable we were to absences in the workforce. It doesn't take much in terms of a gap on the bench to really feel it across the company. And we wanted to do something about that.
Why do you think workplace health is being pushed up the main agenda?
Without a doubt, the pandemic made everybody think differently about health and well-being at home and at work. And I think as employers, we've kind of woken up in a different way to the fact we've always had a duty of care, but that duty of care has kind of manifested itself in a very real way. You know, people getting really sick in the workplace. And at SELDOC, the parent company of Verve, we decided there was an opportunity to extend what we already did and look after the well-being of a bigger population than the one we already covered.
So you're using a combination of healthcare and digital data and digital approaches to really change what you're doing in the employee wellbeing space.
Yeah, common sense approach. We want to bring our healthcare credentials of 25 years together with some good, solid, common sense use of technology to help make people happier, more productive at work, which is in the interest of the individual and the employer. It's as simple as that.
So simply, Stephen, tell me how it works.
The Verve proposition is dead simple. Its purpose is to make workforces happier, healthier and more productive at work the world over. We break that, there's quite a big ambition, but we break it down into some really simple steps. We ask employees, we call them service users, we ask employees to complete a series of online surveys at regular intervals. Those surveys are designed with clinical content, the business is all clinically led, to actually help us spot signs of illness or potential illness down the track so we can intervene early in a proactive way. Once a red flag pops up, someone might need some self-help, some guides, perhaps watch a video, attend a seminar, read a piece of collateral that we've designed. Other people might need an intervention with a clinician, a mental health nurse or a doctor, for example. We'll provide that. And then we'll measure everything all the way along so the individual gets to track their own improvement, but also the employer, in an anonymised way, gets to track the improvement of their workforce. Really, really simple design, easy to get your head around, low cost, and we just want to make it really work for people, which is why we've designed it that way.
So will you be able to get people to their doctor or their healthcare provider more quickly?
There's no delay. So once someone completes a survey, the response to what they put in, our response to their responses, if you like, is instant. So if someone needs to see a doctor urgently, we'll pop up and invite them to book an appointment straight away. If they're not going to have a Verve clinician look after them, perhaps they'll get referred back to their own GP. Again, that's almost instant, where the referral letter will go into their own online portal that they've got by being a service user on Verve. So we don't muck around, we get on with it because people's time is precious.
And how important is data behind the scenes throughout all of that?
Data is really important. We don't need to have, great big server farms full of data. We need the data that's pertinent to the well-being of that individual and aggregated up to the well-being of that organisation. So we're gathering data through those surveys all the time, through the clinical interventions that happen, through the improvement on their journey of healthcare that people track. That's the kind of data that we gather, and then we provide it in a nice oven-ready, easy to read and interpret format so employers can see what's going on in their organisation, where interventions might be needed at an organisation level as well. And again, we keep it really simple. We know what we're doing. We're a healthcare company, been around 25 years, and our job here is to keep it really simple for the employer to help them improve their business.
So can the employer see the employee's own healthcare notes?
No, that's anonymised. So as a healthcare company, there's quite strict rules around keeping people's personal data private to them. We do that. Again, we've been doing that for 25 years, so we know how to do that properly. What we will do is provide aggregated and anonymised data to the employer. So for example, if there was a workforce of 500 people and 52 had back pain, we would say 52 of your 500 people have got back pain. This is the kind of back pain they've got, but we wouldn't say Julie's got this back pain and Fred's got this back pain and Doris has got something else. That's totally confidential.
And how regular are the surveys?
The default is once a quarter, and we decided once a quarter, having taken feedback from customers and service users. There needs to be a kind of fairly regular drumbeat, but people don't want survey overload. But if an individual wants to complete and interact with us more often, they can choose to do that.
I know that SELDOC is a group of 150 GPs. Tell me about the start of Verve Healthcare.
Well, like I said, in the pandemic, we were kind of reflecting on our role in the world, our role in the NHS, what we were doing, how we were looking after people, and some of the kind of very personal experiences we saw people have through the pandemic, getting ill, getting better again, and some people not getting better at all. And there was a lot of particularly workplace stress that went with that because it was a very uncertain time. And being a healthcare company and a small healthcare company kind of up for change, up for doing things in a different way, we thought, let's try and do something about it. So we did a bit of research, quite a bit of research, and decided to have a go at trying to help workforces become happier, healthier, and more productive, because that's good for the individual and good for the employer.
So Stephen, you yourself are in charge of an SME, and so I guess you can see some of the pressures which other managing directors and other CEOs are facing who are also leading SMEs.
Absolutely. When you're running a small company, anything happens, you feel it immediately, whether someone's ill or off work. You haven't got large teams with lots of layers in to kind of, use as backup if someone's not here. People really have to muck in and do extra. And that's one of the big things I've noticed moving from larger organizations to smaller organizations. And I know for a fact that if I'd been able to take some action to prevent some of the illness and absenteeism we've had here on occasions, I would have willingly done so.
So Stephen, what challenges are employers facing in reducing workplace sickness and absenteeism?
The first challenge is to know why things are occurring. It's very easy to kind of make assumptions as to why people are off sick or why you've got a particular prevalence of people coming late to work in a certain part of your organization. You have to start by kind of digging into it and asking the question why in a kind of non-threatening and engaging way with the workforce. Once you've done that, then you can decide how to attack the issue. And that could be a whole range of reasons. It can be work-induced, it can be home-induced, and a much higher prevalence of mental health issues. Again, post-pandemic, we're not through that yet. And even as recently as this week, it's been on the mainstream news about how there's kind of a building up of almost post-pandemic stress in key sections of the workforce.
So Stephen, what are workplaces doing to try to reduce the impact of absenteeism and presenteeism?
Well, a lot of workplaces are doing something. Unfortunately, there are a lot that are doing nothing. And if you do nothing, then it's not going to reduce. There are a whole range of different solutions. And what we do at Verve is to work with employers in a proactive way to try and identify when people are likely to become ill, not just treat them when they have already become ill. And that way, if we catch people early, we can prevent the absenteeism in the first place. The approach we use is clinically led, so we're looking for signs of potential ill health, mental health, physical health, stuff you'd see a doctor for, and then you can be treated by one of our clinicians if that's what's necessary. But the whole premise of Verve is to get ahead of the curve and be proactive and spot the early signs of potential unwellness, if that's the word, rather than kind of just react to it when it occurs.
And talk to me a bit about some of the clinicians with whom you work. I know that Verve was born from SELDOC. SELDOC is a 150 GP strong consortium of general practitioners and family doctors. But talk to me about the clinical aspects of Verve Healthcare.
Well, Verve is absolutely clinically led in terms of the whole ethos of the organisation. So when we design our service user interactions for the surveys that we use, all of the questions that we ask are designed by clinicians to really root out very quickly things that could be signals of a potential problem down the track. In terms of when someone needs treatment, we have a roster or of a bank of clinicians, so physiotherapists, mental health practitioners and GPs, to make sure there's someone available at a convenient time and in a convenient place to treat the person that needs treatment. It's what we've been doing for 25 years in SELDOC, and we're just bringing that skill set across into Verve.
I've been looking at some of the statistics about workplace ill health and the impact on well-being, and they're really quite startling. for every 13 people currently working, one person is on long-term sick, and I find that staggering. In addition, 1.8 million workers suffered from work-related ill health a couple of years ago, which is up almost 6% in the previous year. It seems to be rising and rising. And then nationally, 17 million working days are lost due to workplace stress, depression, or anxiety. These are big, big numbers, but how can a small company, how can a small family-owned company make it really relevant to them? What could Verve Healthcare do to show small companies the size of the problem that they could have?
I think the first thing to remember is that big numbers are made up of lots of small numbers. So every individual who is going to be off sick or potentially unwell is someone that needs some kind of intervention or some kind of looking after. So if you run a small company like Verve is a small company, if we get a sign that someone's struggling a bit, by completing the Verve surveys, we can spot quickly that there's going to be a potential issue unless we do something. What the something is can be agreed with the individual, or we can outsource it or subcontract to a clinical service provider like Verve.
And it's all data driven, isn't it? It's all data led. Talk to me about how you keep the eye on the numbers of the data. How do you measure workplace wellbeing?
Well, we look at, so our service users are surveyed at least once a quarter, and we ask a full range of questions on kind of how they're doing, looking at it from lots of different angles. And like I said earlier on, those question sets are designed from a sort of clinical perspective. We aggregate that data up from all of the service users who've completed the surveys, so the employer can have a dashboard of where their issues are. So for example, in SELDOC, obviously we're a customer of Verve, you get like a little donut chart, a little circle, and that shows you where your incidence of potential health issues are, so we can decide at an organizational level, do we want to do an intervention, not just with the individual. An example of that might be in a larger organization, if there was a high incidence of back pain, for example, the Verve team might talk to that employer and say, let's do an organization-wide intervention on back pain. Could be to do with sitting posture or working patterns if they're working in a very manual environment. But behind that, we're treating every individual as a person as well. So corporate gets the kind of rolled up organisation-wide level of data, looking at interventions that might be necessary at that level, while the individual is being looked after in their own personal circumstances that are relevant to them.
So here I am, Stephen. Assume that I'm a small company. I've got 20 to 25 employees. I'm working in construction. How do I find out what the actual cost of absenteeism could be to my company?
Well, we've developed a simple way to do it is we've developed an online calculator for that. It's on our website, and what we use is industry validated data, which takes some averages, but once you've plugged in your cost of employment and the absence level you see, it will give you a decent indication of the kind of money that you're wasting effectively through absence and preventable illness. What we will then do is actually do an assessment, sort of set up a workplace strategy with you once you sign up to Verve, so we can work out what calculations are relevant to you as an organisation. And sometimes you just have to start small. You have to decide, look, there's 3 people here that are saying they've got mental health issues. Let's just measure how well they feel now and how well they feel in 3 months' time to see they're moving on the right journey. Sometimes small things at that level can make all the difference.
Something which I've always found surprising is that the cost of presenteeism is pretty much double the cost of absenteeism. So having somebody not very well but at work has a greater financial impact than if that person was off sick. Is that something which surprises you too?
It doesn't surprise me. It's a good reminder, because if you think about what happens when people come to work and they're not well, not only are they not performing up to their top potential in their work, other people don't know that person's not well. So actually they're relying on, suboptimal outputs, let's call it, from that person. So there's a kind of consequential effect of that person being unwell and at work. Whereas if someone is unwell and at home, then we know that person's unwell at home and we compensate. We make alternative arrangements in the organisation to cover the work or make decisions in a different way. Therefore, it's less dangerous in a way for the workplace as a whole if that person's known to be not well and away from work. Our job in Verve is to try and keep people well, happy and productive at work, and that's our key focus.
So I can see that you're using data to underpin everything that you do. You're using data to calculate the cost of absenteeism and presenteeism. And then you're using data in the regular online surveys as well to really measure how people are doing, measure where they are at the moment, measure how they've been as well, and you can see trends arising too. Is that right?
That's absolutely right. I think when employers buy the Verve service, they're going to want to see improvement over time. Some of the improvements may be small and incremental. We can talk about small companies. A small positive change can make a massive impact to a small organisation, and lots of small changes can make a massive impact to a larger organisation. So it is really applying proper, structured, common sense and good clinical intervention in a timely way.
So Stephen, you're really using data at every single step when you're advising clients on wellbeing strategies as well, aren't you? Tell me a little bit about that.
Well, the data we gather from individuals is kind of aggregated so that we can see at a cross-organisational level where the issues are. And it's important when we develop a wellbeing strategy with our clients, something which we make readily available to all current and potential clients, that we really home in on the things that will make the difference. So, for example, if an organisation has a high incidence of mental or workplace stress, then that's the thing we need to intervene on using the expertise of our mental health practitioners. But if it's more to do with physicality and posture and musculoskeletal type conditions, then that's where we would focus. The great thing about the way in which we gather and report data is it's simple, clear and transparent. So very quickly we can get to the heart of the issue. And I would like to just kind of confirm, if you like, that whilst the data that happens in the exchange between us and the individual is totally confidential, when we aggregate it up, it's all anonymised, so no individual can get identified from their healthcare perspective to their employer. That's really important.
I can see that data is absolutely crucial to what you do at Verve Healthcare. It drives the approach for organisations that you work with as well. And I really like that you're looking at the whole person when you're looking at the data behind what that person is telling you. There are so many interdependencies of your mental well-being, your physical well-being. Something might be happening at home affecting work, something might be happening at work affecting home. Tell me a bit about that from your perspective.
Well, I think to make the complex simple, you have to keep remembering that every person is an individual and there's bound to be hundreds of different influences on that person's life at any moment in time. When we actually interact with an individual, with a service user, we are using data to discount things as much as to count things in. A bit like when you have a consultation with your GP, what they're doing with you is asking you questions to make sure that certain things aren't happening so they can identify what is happening. That's the same kind of premise on our clinically led survey structure, how we ask the surveys. When we're actually sharing that data with the corporate, all we're doing is adding that up for all the individuals in the organisation, keeping focused on what matters most to the individual, and therefore by aggregating that, we're actually keeping it focused on what's going to matter most to the company. And then it's a very simple, straightforward application of the learning from that to decide what interventions are appropriate. There's no rocket science in this. It's just about structured, clinically led, common sense and doing the right thing. And it doesn't have to be expensive. There's so much complexity in life, and we didn't want our thinking in workplace wellness to add to that complexity. We wanted to demystify it a bit and use our 25 years of clinical experience to actually make it work for people in a really straightforward way. And that's what we've done. That's how we've built the Verve proposition.
When you're looking more broadly at the healthcare landscape in general, tell me about what you see organisations using digital initiatives and using digital technology to enhance what they're doing.
I think one of the things that digital enables you to do is to achieve consistency in terms of how you reach out to people and how you pull information in from those people. Ultimately, for complex situations, it's likely to be a human-to-human interaction, but even a bit like our conversation today, we can do that digitally. We haven't got to physically travel and be in the same room around the same table to get a good high-value outcome. And a lot of the clinical interventions we deliver through Verve will be remote, a bit like this conversation. But where someone actually needs to be physically present to be looked after properly, then we'll facilitate that at all. So I think digital is part of the way life is. It's not all of life.
People are going to ask about healthcare and AI. The introduction of ChatGPT only just a few months ago is changing the landscape for so many different sectors at the moment. Talk to me about what impact could be for people's health.
If we approach that question almost intellectually, there's no limit to the possibility of artificial intelligence. I'm going to say, however, if you think healthcare is delivered to people maybe through AI, but originally from people, I think a lot of improving people's health has got to do with how confident they feel in the interaction they're having with the solution provider. I was talking to someone recently who runs a small business whose wife was poorly, and he was talking to me quite eloquently about AI and its boundless possibilities for the future. And I asked him a question. I said, how will your wife feel when her condition is diagnosed by a computer rather than a person? And I think that's where the rub is. It's going to change over time, but we need to take people on that journey so that people don't lose confidence in the healthcare intervention and solution they're receiving. We're all subject to versions of AI every day. So when you ring up an automated telephone system and say, is it your leg or your hand? In a way, that's a bit like a very, very rudimentary form of AI. It's kind of guiding you through a process. Like I said, in theory, the possibilities are infinite, but we've all got to go on that journey as we get used to it in our lives. And people have a high degree of trust in healthcare provision. And if you've got something that's very personal or very serious, most people still want a bit of that human interaction, and we're going to make sure we provide that.
Talk to me a little bit more about the opportunities that prevention offers. I'm thinking about a particular scenario of somebody I was talking with the other day, where he felt that he couldn't bring up the fact that he was becoming more stressed with his manager, and he got to the point where he went off with stress because he felt he couldn't talk to his manager. How do you think the answering healthcare surveys might have helped him or helped his organisation spot what might have been going wrong a little bit earlier?
I think the first thing is, if someone is feeling nervous about talking to a person from their employer, the fact that employer is using the Verve service means there's a kind of objective third party in the middle. So it kind of de-stresses it a little bit. I can have a confidential conversation with someone who is not my employer and then rely on the fact they've got all the confidentiality provisions in place that won't get transmitted on a like-for-like basis. So that kind of should give me confidence as an individual to be very open about what's going on for me. I then think the employer can take confidence by working with a trusted healthcare provider that information is going to be aggregated in a way which is helpful and useful for the organisation, and that the individual is going to get treatment that's clinically appropriate for their condition. I know for a fact that in a small company, when someone senior goes off, you're not just losing the cost of paying them to be at work when they can't be at work. There's all the missed opportunity of a report being late, a customer proposal not being done, a missed new business opportunity. There's a lot of hidden costs of absenteeism, and by helping that person stay at work, maybe even on reduced hours, maybe even with a different shape of what they're doing, that's still a lot better for the company than suddenly losing that person for a protracted length of time.
So the cost of absenteeism and presenteeism is more than you can just count, isn't it? There's all kinds of different impacts on a business. What kind of feedback are you getting when you're speaking with small business owners in that area?
So people are very clear and worried about the pure cost of absenteeism, which can be measured. Presenteeism as a phenomenon is starting to be understood, but nobody really knows how to measure it, but to take an estimate. And I think employers are worried not only about the replacement cost, the hiring cost, but in a small business in particular, you've got people who got to work twice as hard to cover the fact that someone's not there. People are worried that that's going to have a health consequence on the people that are doing the covering, and that over time that stacks up yet more problems for the future by not intervening early and trying to prevent or at least diminish some of the impact of that person being poorly in the first place.
So Stephen, why are we seeing an increase in the number of people going off with mental stresses, but also physical conditions too? What's happening in the world of work?
I think, first of all, the incidence of reporting things is going up, and that's a good thing. So one of the reasons why we're seeing increased numbers of reported issues is because there are more issues being reported that perhaps were unreported before. But in terms of the underlying health trend, if you think about the way life has changed through the pandemic, and it's changed for good, people working at home in a hybrid or a permanent way has got health consequences. So it tends to be fairly sedentary. You're sitting down for very long periods of time, usually much longer periods of time than you would spend in the office. You know, you'd walk around and talk to your colleagues when you're in the room. When you're at home, you can walk around the room and talk to yourself, but usually you're sitting on a screen to connect with people on a phone. That can have a physical impact, obviously, through lack of movement, lack of exercise. In addition to that, mental health, the world is changing. Not only changing through the pandemic when there was a lot of fear in society at large all around the world. Nobody really knew what was going to happen through the pandemic, who was going to get ill, who was going to die, who was going to recover. Massive human impact of that. And in addition to that, we've now got obviously conflicts in the world. We've got high interest rates, economic turmoil, political turmoil, and we all think we're probably a little bit immune to that, but we're not. It has a very deep and almost hidden impact on every single person to a different degree. So all of those things are having an impact on the whole person, and a person is a person when they're at work. So some of those things are going to come out as manifestations of stress in their lives, including their lives at work. And that's partly why we're seeing an increase in it.
So mental stresses, physical stresses, financial worries, that connectivity all meets together.
It does. A human being is a human being, and those different influences have different degrees of influence on us according to who we are and our lifestyle and the way we are wired. But they're all there. We don't stop being a person when we're at work. We don't stop being a worker when we go home. And I think part of dealing with workplace wellness is to recognize that every worker is an individual and a human being, and be a bit more human in how we manage them as well. How we would like to be managed is usually how other people would like to be managed, and having data to identify what's going on for that person really helps us intervene in a targeted way. We're all human beings, aren't we? We're all part of society, and in every organization there is a society. And when you actually talk to individuals about what motivates them or what demotivates them, more often than not, it's about the people they're working with and spending time with. How they are managed is about the human interaction between two people. Usually, it isn't some kind of rule book somewhere. So the coming together of groups of people as societies and organisations has a massive impact on the well-being of the workforce, which in turn has a massive impact on the profitability of the company. We haven't got to make enormous changes all the time, but a few common sense nudges underpinned by data can make the world a difference.
So Stephen, as you manage 2 SMEs, and given your broad corporate experience, what's the most effective way to reinforce the work so it's more than just a moment's focused?
I think it's a great question. If you want to do this seriously, and every employer should, you've got to stick at it. And knowing that employers need to stick at it was part of the reason why we decided to have a very low cost type of intervention that you can scale as you need to. We will build a relationship over time with the service users and the employee is one which needs to endure, so we see the benefits of improvement over time. If we just think it's a quick one-off intervention, it isn't going to work. It's got to be a sustained series of interventions over a period of time, as we all as human beings would want if we had something that we needed to help. We need some help with. So
who can make this change happen in a small company, Stephen?
Well, lots of people can. I mean, the formal responsibility should sit with the HR or wellbeing team. And as a CEO of a small company myself, I think a bit of that responsibility has got to sit with the CEO as well. You set the tone in your organisation, even by the way you are, let alone what you say and what you communicate in writing. Therefore, I think if you as a CEO show passion and interest, doesn't have to be over the top, then your organisation will follow. And that's going to make such a huge difference, not only to the employees in your organisation, but also your bottom line. And that's just as important for me as a CEO of a small company as it is about looking after the people.
So thank you so much, Stephen. I've got one last question for you, and it's around your company values. One of your values is love, and I love that you really wear your heart on your sleeve, but it's a very bold and quite unusual value to have. Can you tell us a bit about how that came about?
Yeah, absolutely. When we got together and started to think about how we could use SELDOC skills and experience in a different way, we came up with the whole Verve proposition. One of the things we considered as a team was what would we love to do? What difference would we love to make? And we decided we would love to make workforces happier, healthier, and more productive at work. And that was kind of where it started from. We then thought about the kind of experience we wanted our service users to have through their interactions with Verve, and we want people to feel loved, to feel cared for, to feel that we're bothered about them in the way we interact with them and provide them with care if they need it, or advice if they need it, or leave them alone if they need it. And we wanted employers to love the experience of transparent data, low pricing, good management information, helping them do an even better job of managing the relationship with their workers and making their businesses more profitable. So in the round, really, love is important to us, whichever way you look at it, and we decided to put it there as a value, front and centre, and we're really pleased we have.
That's wonderful. Thank you so much for your time, Stephen. Thank you.
Thank you.